Cardiology. Cardiology is a subspecialty of internal medicine. A doctor of cardiology, a cardiologist, deals with diseases and maladies of the heart and blood vessels, the cardiovascular system. Cardiologists are experts in the processes and prevention of heart disease, as well as in ways to improve survival rates and the quality of life for people who have suffered from such cardiovascular problems as heart attacks or coronary artery disease. Dermatology. A doctor of dermatology, a dermatologist, finds, prevents, and treats diseases of the skin, hair, nails, and adjacent mucous membranes. Dermatologists identify and treat more than 3,000 conditions, and they help improve the quality of life for people suffering from minor and irritating conditions to severe and life-threatening maladies. Subspecialties include dermatopathology, micrographic surgery, dermatologic oncology. Endocrinology. Endocrinology is the study of hormones. An endocrinologist is a doctor that treats diseases related to problems with hormones. A hormone is a chemical messenger that travels from one cell to another. There are whole subspecialties devoted to specific areas where hormones work. For example, pediatric endocrinology, looking at hormones in children. Thyroid endocrinology, looking at how the thyroid affects metabolism. Endocrine disrupting chemicals, where chemicals which mimic the effects of hormones are present in the environment. Comparative endocrinology, which looks at the way similar hormones work in different species, for example, from insects through to fish, birds, mammals, etc. Gastroenterology. Gastroenterology is the study of the normal function and diseases of the esophagus, stomach, small intestine, colon and rectum, pancreas, gallbladder, bile ducts, and liver. Hematology. Hematology is the study of blood and blood disorders. Hematologists and hematopathologists are highly trained healthcare providers. They specialize in diseases of the blood and blood components. These include blood and bone marrow cells. Hematological tests can help diagnose anemia, infection, and hemophilia. They also include blood clotting disorders and leukemia. Anesthesiology. A doctor of anesthesiology, an anesthesiologist, practices anesthesia, the use of medication to produce a loss of sensation, particularly pain in the body. Without anesthesia, most surgical operations would not be possible. Anesthesiologists are trained in the administration of anesthetics throughout surgery, childbirth, and other medical procedures. Anesthesiologists are important throughout perioperative care, which includes pre-op and post-op responsibilities as well as care during procedures themselves. Subspecialties include adult cardiothoracic anesthesiology, critical care or pain medicine, obstetric anesthesiology, pediatric anesthesiology. Emergency medicine. Emergency medicine is one of the most important branches of medicine responsible for tackling critical situations, from accidents and heart attacks to other urgent cases. This branch of medical science demands quick reflexes, decisive action, and the ability to work in emergency rooms and off-site locations. Resourcefulness and quick thinking are crucial, as you may need to treat patients with limited equipment and medications. Anatomy. It is the branch of medicine and biology which is concerned with the shape and structure of body and the relationship of its organs, also related to morphology of animals and plants. Immunology. Immunology is the study of the immune system and is a very important branch of the medical and biological sciences. The immune system protects us from infection through various lines of defense. If the immune system is not functioning as it should, it can result in disease such as autoimmunity, allergy, and cancer. It is also now becoming clear that immune responses contribute to the development of many common disorders not traditionally viewed as immunologic, including metabolic, cardiovascular, and neurodegenerative conditions such as Alzheimer's. Obstetrics and gynecology. Bridging the gap between obstetrics and gynecology, OB/GYN offers a holistic approach to women's health. This medical branch provides care throughout a woman's life, supporting them during pregnancy, childbirth, and the postpartum period. OB/GYNs address concerns related to the female reproductive system, including preventive checkups, diagnosis and treatment of conditions, and menopause management. Family medicine. A doctor of family medicine, a family physician, provides primary medical care to people in every stage of life. Versatile family practice physicians treat men and women, young and old. They may provide care from before birth, throughout childhood and adulthood, and into old age. Family medicine often attracts doctors interested in a broad range of primary care and in the building of patient relationships that may last for many years. Dentistry. Dentistry, the profession concerned with the prevention and treatment of oral disease, including diseases of the teeth and supporting structures, and diseases of the soft tissues of the mouth. Dentistry also encompasses the treatment and correction of malformation of the jaws, misalignment of the teeth, and birth anomalies of the oral cavity, such as cleft palate. Pathology. Pathologists are experts in the diagnosis, prognosis, and treatment of disorders of body tissues and fluids. Pathology, the study of disease, combines science and medicine, and it requires an extensive and detailed knowledge of both. Pathology deals with every aspect of patient care, from disease prevention and diagnostic testing and treatment to the use of new technologies. Pathologists identify and treat numerous conditions, and they can help improve the quality of life for people with chronic and often life-threatening maladies. General surgery. General surgeons are specially trained to perform complicated procedures, and they operate to treat disease, deformities, and injuries. General surgery includes a broad spectrum of surgical conditions affecting almost any area of the body. A general surgeon makes the diagnosis and provides perioperative care to patients. General surgeons are often responsible for the comprehensive care of trauma victims and critically ill patients. Surgeons must be capable in nearly all forms of surgery, and they should be able to handle a variety of emergencies and unexpected events in the operating room. Rheumatology. Rheumatology is one of the most crucial branches of medical science. It mainly focuses on the diagnosis and management of complex conditions affecting the musculoskeletal system, such as arthritis, lupus, and fibromyalgia. Rheumatologists employ a multidisciplinary approach, incorporating medications, lifestyle modifications, and alternative therapies to improve quality of life for patients with chronic pain and mobility limitations. Plastic surgery. This is one of the most gravitating branches of medicine due to the recent trends and accessibility to cosmetic surgeries. It is one of the most exciting branches of medicine that addresses a wide range of concerns, performing cosmetic procedures to enhance appearance and reconstructive surgeries to restore function and form after injury, disease, or congenital disabilities. Their expertise covers the face, skin, breasts, limbs, torso, and external genitalia. Urology. Urology is one of the most sought-after branches of medicine due to its increasing popularity. The reason for the spike in the popularity of urology can be credited to the increasing awareness of reproductive and genital health. As a urologist, you will be responsible for the healing and health of the urinary tract and reproductive systems. Urologists treat several organs, including the kidney, bladder, prostate, and urethra, alongside the male and female genitals. Neurological surgery. Neurological surgery treats disorders of the central, peripheral, and autonomic nervous systems, including their supporting structures and vascular supply. Neurological surgeons provide such non-operative management as critical care, diagnosis, evaluation, prevention, and rehabilitation, as well as such procedures as endovascular surgery, functional and restorative surgery, spinal fusion, and stereotactic radiosurgery. Neurosurgeons treat disorders of the brain, the extracranial carotid and vertebral arteries, the meninges, and the skull. Neurosurgeons also treat disorders of the cranial and spinal nerves, the pituitary gland, the spinal cord, and the vertebral column.